Good morning, Steve Stites. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio here at KU Hospital. Joined, of course, by my right-hand man, Dr.
Hi.
Dana Hawkinson, Hawkeye, back with you this Friday morning to answer your questions. And today's program's kind of special, but just remember, you don't want to let go of this program until the very end, or after the very end, because we're going to deep freeze this program, Dana.
Yeah, it was cold.
It was really cold. And if you want to know what that means, you're just going to have to stay and watch. We've made it to Friday, and it's been a great week of discussion around getting back to school. And we have some final questions that we want to go through today. Our team has worked incredibly hard at creating a little bit different of a format today to help you see those questions, and I do mean see, and then to help us answer those questions. So it's going to have fun. We're going to have a little fun on a Friday morning, which I think is appropriate.
Yeah.
So are we having fun upstairs in the ICU and in the hospital?
I think we are. We're
All
doing
right.
better than we were at the beginning of the
Thank
week.
goodness, we like that.
So, still above 30. We had 36 that we peaked out at, but right now 32. So 5 of those are in the ICU and 4 of those are on the vent. Unfortunately, the bad thing about this is we did have 4 discharges yesterday, but we had 8 new admissions.
Ouch.
So
I don't like that ratio.
No, and we also did have 1 death of a very young person as well. So
that's our first death
been
since
real.
June 27th.
It's been a while.
It's been
Yeah.
a long time. I could have gone a lot longer before we had to say that. Yeah.
So the numbers are overall better, but we'd still like to get them down to the 9, 10 range, 0 range.
And it all comes down to remembering the coronavirus is not a superhero. It is not a supervillain.
Right.
It feels like a supervillain, but it can't jump tall buildings, and it can be contained by a very simple mask. So if we beat KC, we can beat Corona. And that's got to be our message, and that's what we're going to remember, because we can do that. So we have some pretty cool questions, and they've been great questions this week. We've picked several to kind of summarize questions about staying safe with us and about going back to school. So we're going to dig in. So we got a couple special videos that we want to show you. And then remember, hang out so we can talk about what a deep freeze looks like. So what's our first question this morning? Okay, we are teeing up our first question while we do that, Dana. Where do you think we're going to settle around for the coronavirus? What do you think? What's your prediction for how many folks we'll have here in the hospital?
We've always said we could have up to 40 to 50. We hope it doesn't get to that. I think if we can continue to hold while there is the spread to 30s, that would be great. But we know now that so many communities are instituting the mask mandates, which is really good. So the mask plus the lack of gatherings and doing the physical distancing, I think we will be able to really decrease the spread and flatten the curve pretty quickly when those things are going on. And hopefully by the next 3 or 4 weeks when school does start. So, because that is a big topic for everybody. It's a big topic for the children, for the parents, and of course the teachers and other administrators who are working there.
And I'm going to predict that we're going to top up at around 40 patients here in the hospital, and we're going to be okay with that. We'll be all right. And we hope that if we can continue to see the more masks. I mean, I am so happy when I go outside and see a lot of people masked up. When you go into a grocery store, everybody's masked up. You go into the business, people are masked up. And I think it's beginning to have an effect. We know that all the things in Wyandotte County the last few days, they had sort of begun bending the curve. Where we really got to bend the curve is Johnson County. We saw some data this morning that's still showing exponential growth. Got to hope that more masking and being even more conscious of public events is going to solve for that, and that we'll be better off in the very near future.
And I think to your point, the public events and the gathering, there is a pre-pub, so it's on one of the preprint servers, which is not validated or peer-reviewed, but there's a modeling by a group out of Texas who really also showed in that modeling that really the closing of the schools did not stop the spread as much as the physical and social distancing. So if that can occur, I think we can really decrease the spread when we get to the schools opening.
Yes, I think that's a really important thing. It is about that physical distancing, wearing a mask, wash your hands, all the things we've been talking about all along. So Jill, it looks like we're ready to roll this morning. Are we ready to go?
I think that we are.
All
And
right.
we have questions.
Awesome.
Let's go to our first question.
Excellent. We're ready.
Are we worried about the long-term vaccine side effects?
All right. What do you think about a new vaccine that comes out? Are we really going to be that concerned about that, Dana?
You know, I think we are. We are concerned about it with anything due to, first of all, just the individual safety. But we know that right now these vaccines look safe. Again, it's a different technology than we've used in the past. Now, we are using some of the technology that we've had a basis for, but it's different than, say, some of the other vaccines. So we are always worried about safety. Right now, it looks very safe. We know there's a lot of consternation and debate. There is an anti-vax movement, but we really need everybody to be able to get on board and get the vaccinations. So we are concerned about it, not just we, but I mean we as the medical community, as the public health community. Dr. Fauci, they are very concerned about safety, but right now it does look safe. So
here's what I know is vaccine science has been around for a long time, and people have tried to look at influenza vaccine and said, gosh, did it cause some neuromuscular disease? Did it cause this or that? When you really examine it, we're not finding that.
Nope.
You know, we're trying to be really honest here, but I don't think that there is reasons to be fearful of the new vaccine. And as you make an individual decision about whether you're going to take a vaccine, and this is the first time we've really gotten into this part of the conversation. It's something we're going to be talking about increasingly. As you begin to think about, am I going to have that vaccine? You have to think about it in terms of the risk-benefit ratio, and we do that in medicine all the time. And it's kind of like, you know, you're driving down the highway, and am I going to stop and get gas? Am I going to push a little further and try and go a little bit more? You know, there's a risk-benefit ratio to that. Well, that's a lot bigger question than that because it's about life. And what we know is that vaccines do save a lot of lives. And around coronavirus in particular, when it is such a deadly disease, and again, it is not influenza, and you and I know that. We see patients with it. We know that people are dying from it. As you mentioned, the young person who passed away yesterday. Then what we know is that that's not something that should be trivialized, and I think we shouldn't be trying to politicize it. We'll put all the data we have out there, and on this program, I guarantee we will be open and honest about what we think about vaccinations, and we'll talk about the science of it, and we'll show you the data around it. Because that, I think people have to make an informed decision. But the simple truth will be, I really believe this, that the vaccines will save a lot more lives, and the side effects will be relatively minimal.
Yep, and just to your point, you know, there was a big issue about the flu, the swine flu vaccine in the 70s causing the Guillain-Barré, what you talked about, the neuromuscular. And what they actually found was that you had a higher chance of getting that if you got influenza rather than the actual vaccine. The other thing, to your point, is that it's not flu. There's another preprint article out of the UK when they looked at people with COVID-19 pneumonia versus people with other viral pneumonia, not COVID-19, and the death rate was twice as high in the COVID-19 pneumonia group compared to the other viral pneumonias, including influenza. In those patients in the COVID-19, they were overall healthier and had a lower BMI, which means they were not as obese or you know, as heavy as those people. So it is not flu. It does affect even other healthy people.
And you know, that's the thing about it, and we just have to come to terms with the reality and trying to. And again, too often COVID has been politicized, and what we're trying to do is let's is that a word? Healthicize it? I don't think that's a word. Kind of try to medicalize it. Well, medicalize it. That sounds better. And just to try to tell the story about it and stay honest about it, and that's what we're going to do. And then everybody has to make a choice. So I see Harrison up on the screen. Is Harrison ready to ask us a question?
Our second question is from one of our younger viewers, Harrison.
Hi, my name is Harrison, and I live in Olathe, Kansas. Dr. Hot Guy, can I still trade Pokemon with my friends at school?
Okay, Hawkeye, you better give the right answer here, dude.
Yeah. Is this the Pokemon cards?
Oh, come on. Are you really asking that question?
I don't know if there's toys.
No, there's cards.
Okay.
I
You
said
know a lot
Pokemon
about
cards.
it.
Oh my God. So
A lot
we
more than
moved
I
not
do.
so long ago. So I found Pokemon cards everywhere. So James, thanks for that. Love you, man. But oh my gosh.
Thank you. You know, I think that the trading of the cards itself is going to be fine. It's the issue with the distancing.
Yeah.
So if you can try and maintain a distance from your friends, 6 or 8 or 10 feet, if you can be outside doing the trading, actually picking up the cards, if you're doing proper hand hygiene, I hope you have alcohol gel or alcohol spray and or washing your hands frequently, you're really going to be okay doing that. But again, if you can be separated from your friends by a little bit, 6 or 8 or 10 feet. Maybe talk with your parents and see what that looks like. And if you can just start to do that, I think it would be safe to trade Pokemon.
And I would just say, Pokemon those cards are kind of cool. I tried to take my son on a few Pokemon games, and I got trounced. So I'm not sure that the Pokemon is really meant for 30, 40-year-olds. Okay, I may be older than that now. But you can be safe, because I think the question for parents is, are the cards themselves safe because your hands have been on them?
Yeah.
I think the answer to that is, use a little alcohol sanitizer.
Yeah.
Surfaces are probably not the big deal. It's that physical distancing.
Yes.
If they have a mask on, that's a lot safer.
Yep.
And I'm going to bet Harrison's a little younger than 9 years old.
Yeah.
Which means he's probably a little less at risk.
Yeah.
But it's not a perfect world, so we can't take that part to the bank. So try and do that physical distancing.
And I think that goes to the point we were talking about yesterday in the classroom about paper and tests and all that.
Yeah.
And again, it's the same thing with the cards, but if you can be the distancing.
Wait. Are you advocating for no tests in schools?
No paper. Well, you can use paper tests. No, not at all. We said that if
I thought you were about to become the most popular man in America, but I think you just fumbled it.
No, we need tests. My kids need
Fine.
tests. Their brain has turned to mush, not going to school and not having that learning. But you can use the paper tests or the handouts or the sheets. That's not the issue. It's the same as the cards. It's if you can have the masking and the distancing, it'll be safe.
Okay. So we see our second question is, and what we've done is taken the questions we've been getting from the community around school and returning to school and try to wrap them up and put them into these different categories. And so that was the first one, first couple. We talked about vaccination. We've talked about Pokemon cards. I like the Pokemon question. Can kids interact safely with each other at school? Which is kind of the Pokemon question, right?
We kind of.
So what do you think?
I think they can. I think they need that emotional, spiritual, and physical interaction with other children and with teachers and other support people at the school. But again, in what ways are they going to go about interacting is the important part about that. There should definitely be some distance. We know that we've talked about the ages. Certain ages, 10 and above, look to be more able to spread the disease like adults can compared to 10 and below. But we still don't know the full answer to that. So I think the interaction, the safest thing to do is, again, have both kids or the group of kids in mass if they're able to wear it, and continue to try and maintain the distance as much as possible. I know we say 6, 8, 10 feet. Certainly we know the World Health Organization uses 3 feet. I think the Academy, the Pediatrics, American Academy of Pediatrics says 3 feet, and that's in the classroom itself. More distance is better. And of course, wearing masks is better too.
So mask and 3 feet probably can work. We prefer 6. It's hard with young children, I think, because they're not going to really physical distance when they go running and colliding into the classroom. But fortunately, they don't appear to spread the disease as much as we get older. It's funny. People try to figure out a way around. This is like talking to my kids. My daughter, there was this dress code in school. I'm telling a story about Ilea, my oldest. There's a dress code in school. You couldn't show your belly button. Mm-hmm. And so in the morning, she would come downstairs sometimes. She's going to hate that I tell this story. And she would have this, the blouse or shirt or whatever was on. And I'd say, Ilea, how you doing this morning? And she'd walk in. She'd become hunched over like this. I'm good, Dad. I'm good. Ready to go to school. I'm like, hey, kid, you're going to show your belly button. You can't do that. No. Raise your arms. Let's see what happens. It's like, no, that doesn't count. You can't just put your arms up. Of course, her belly button showing it. Okay, go change it. Well, we did that a couple of times on a certain morning. So I had to leave her at home. I went back and got her. She was very upset. She was very mad, but she didn't do that again. But I think she probably had a change of clothes at school. That I don't know.
Yeah, we had that too.
But the point is that you can try and get around these rules of infection control or the rules of dress code, but they're going to catch up with you.
Yeah.
That's the point. They catch up with you. And unlike showing your belly button because your blouse is too short, that's a minor problem.
Yeah.
Coronavirus, not a minor problem. And we can prevent it. That's the key. We can prevent and halt the spread of this darn thing. So wearing a mask, keeping your distance, does make a difference. Can you interact safely? Yes, you can. Will it look like the way you're used to interacting? No. Not right now. Give it a little longer.
Yeah.
And when those safe vaccines come out, it's going to change the rules again.
Right.
That'll be good.
Absolutely.
All right. Looks like our next question is, can testing keep up with the increase that will come with schools back in session?
Mm-hmm.
What do you think?
Well, as it stands right now, as far as testing capacity, I think that's a no. As we get back into schools, but depending on what it looks like, we've talked about if people are starting to wear masks now, the culture is changing. And again, we know where the biggest spread is. It's in the gatherings, whether that is bars, those are, pointed to a lot, but it's also other gatherings, whether it's parties, graduation parties, birthday parties, funerals, weddings, anything like that. When those gatherings can stop and those people can not congregate in as much, certainly 50 or less, 10 or less, it's going to be a lot better if you can spread out. We know that we will be able to decrease the spread of this virus, so therefore making schools safer. Now, once you have people getting back, again, there was that modeling out of Austin that showed really shutting down the schools didn't do as much to stop the spread as the other shutdown measures, such as the physical distancing and, of course, the mask wearing. So, as we get in there, hopefully the other companies that are creating the test reagents, what we use to do the test, will have a little bit more capacity to do that. And there will be all of the places that are able to do the test, whether it's clinics, the hospitals, the private entities. If we can do that and get the testing capacity, we should be okay. But right now, with the number and the spread of the disease, certainly we are already in testing capacity crunches.
Yeah, and what we know is that for some of those companies who are doing the testing, like Quest at LabCorp, which are some of the lab companies, they're out to 5 to 7 days, which means really that test isn't going to be so useful to you, because how are you going to do contact tracing when it's 5 or 7 days old? Because those people are all out. They've all, that horse is out of the barn. So I think what we need is to remember to wear your mask and to physically distance, because we're fine as long as that happens. But if schools reopen and restaurants are all open and bars are open and churches are open and groups are gathering and big graduations are being held, that's not going to go well.
Right.
Especially if people don't have masks on. But if you wear a mask and you follow the rule of social distancing, then it's going to be okay. And we'll be okay with testing, and we can give answers to folks and get the right treatments in place. Because there are two ways. If testing's overwhelmed, health systems are going to get overwhelmed.
Yep.
Those two things are going to travel together, and you don't want to be in that situation, because what we know is when hospitals get overwhelmed, outcomes go down. And we've seen that across the world and across the United States, that the rate of death begins to increase when people are overwhelmed, which is, that's no shocker, right? If you don't have enough facilities to take care of sick folk, you don't have all the right equipment and all the right physicians and nurses and the ICU beds, then you're not going to have as good an outcome. And that you just have to be thoughtful that every time we don't wear a mask, we don't physically distance, the ones we put at risk are ourselves and our loved ones, and our community. And that's where we need to be, KC. So are we saying, do you think, and does safe mean zero COVID-19 cases in a community?
Yeah. I don't believe it does. I'm not sure at this point we'll get down to zero community cases. That's not an optimistic view. I think that's a realistic view until we get some sort of vaccination or some other means of getting immunity from this, whether that's herd immunity. I think even now there are other cold viruses circulating in the community. We know this. We have tested people who come in who look like or similar, having symptoms, maybe not as severe as the critical COVID, but we are testing those people for COVID 1, 2, sometimes 3 times, and they're negative. I think there's other cough and cold viruses going around. So there's always something circulating. I don't think there'll ever be zero cases in the community. Does that mean it's safe? I think we can get to a safe period if people, again, as we start changing our culture in the way we interact now as compared to, last year at this time. So it is the masking, the distancing, doing all those proper things. But getting the community cases down either to very small amounts, but certainly not on the increases that we're seeing right now.
Yeah, I think that's a big deal, and I think that we won't be at zero, but we can be at a level that we can handle it, and isn't that the key, really?
Yep.
So, how can students and teachers eat lunch safely? It feels like the answer there is really the same answer that we have right here at the health system. We had a very crowded lunchroom where a lot of people were packed in, both employees and nurses, physicians, and visitors. And we had to change that lunchroom. We had to turn that thing upside down. We took out a whole bunch of the tables and the chairs. We've enforced physical distancing. We did it as you go through the cafeteria. And we've been doing that with our employees and said, okay, look, you're either going to have to go outside to eat. You can't have this many people in a break room. So that's really the message. And that's, again, the principles of infection control exist no matter where you are. Now, if I'm at a school, I don't know how all that can play out at a school, right? I'm not an expert in school design. But what we know is that if you will do the same things, if you will wear your mask, and when you sit down to eat, you take your mask off, because obviously you can't eat through a mask. That would be a challenge. You take off your mask, and then you eat your meal, and you put your mask back on. While you're eating, you just try to be as distanced from people as you can.
Yeah.
As you pointed out earlier, the World Health Organization has been saying at least 3 feet.
Yeah.
There, and that'll, maybe our deep freeze video will show a little bit about that. At least 3 feet, but preferably 6 feet or more.
Yeah.
Or if you can go outside and eat, it just makes all the difference. So you can eat safely, but you have to be thoughtful about how you do it.
Yeah, and I know you can be creative in the school districts, in the schools themselves. We know that everything is not ideal. We have talked about this. I'm actually more concerned about the adults eating, whether it's the administrators, the counselors, the teachers. We have seen that there is healthcare worker spread because they are eating in the same break room together and not using the mask.
Bugs the heck out of me, because
Yes.
we should be the leaders in the field, not the
Right.
followers.
So I would be more concerned about that population than the kids themselves. But if you can find creative ways to do that in your school, separating the kids as much as possible, but also keeping the people who work there safe by having them continue to maintain what we have talked about, and that's the distancing. Obviously, when you're eating, you can't wear a mask, so the mask will have to come off. But if you can maintain that distance, that will help a lot as well.
You know, Aaron Corvo and Ellen Greiner were on yesterday, and they're some of the health officers for Wyandotte County, and had a lot of great advice. If you can go back and find our program from yesterday and see, they actually addressed some of these very questions,
Yeah.
and their discussion did a great job, and talked about how schools can find different ways, and some of the ways of Wyandotte's trying to do
Yeah.
things a little differently. And I know other schools are. I don't know about every single local
Right.
school, and I know in Kansas most of those decisions are left up to the local community, because some communities have very little COVID-19 and some have a whole lot, and they may have different approaches. But the truth is that coronavirus is spreading west. It's spreading throughout the state, as it is throughout the country. And what we know is that, again, the principles of infection control go with you no matter where you are. And the more you can separate, the better off you are going to be, and the more and the safer you are. And sometimes that forces you to really think how your entire day goes, and whether or not you have split shifts for schools, or some days some people are at school and some days are at home and they flip the next day. I don't know all those choices, but I can say that it does make a difference if you follow those rules of infection control. So, how do we get young kids to keep a mask on? Dana, would a face shield be better?
Yeah, for the second question, there is no validated data to say that a face shield is better. We still believe that the mask, whether it's a cotton face covering or whether it's a surgical type mask, again, you can buy those now in the hardware, the grocery store or the pharmacy. We still believe those are better. Face shields are great. They will offer eye protection. And I'm talking about the face shields that look like the welder's masks that go up there.
Yeah.
I think that would be hard to keep on a child as well.
I do too.
I think either way it's going to be difficult for the children to keep it on. I think it's just a matter of continuing to talk with them, encouraging them. It's obviously not going to be perfect, but do everything you can to work with them to try and keep it on, to try and not manipulate it, things of that nature. But I don't think that the face shield itself is going to be as efficacious as what we have seen in the published data about the face masks.
Yeah, and I think that, so face masks are certainly better. Trying to do all the cool things parents can do around those face masks, having kids help make their own, trying to make a game out of it, but modeling the behavior becomes really important, and practicing it before kids go to school. I think if you wake up on the first day of school and say, time to put that mask on, the kid's not worn a mask all along, that's going to be a challenge. You got to do it at home. You got to start demonstrating the behaviors and start teaching the behaviors that you want kids to have very early on. And I think that can make a big difference. And otherwise, you're going to be asking the impossible.
Yeah.
So
Just
I think that's
with quote unquote, with kid gloves on. Just keep encouraging them, working with them, and that will help you as well. But I think to your point, the modeling is very good.
Yeah, and don't wait for the first day of school to have to teach kids about how to put a mask on and take it off. And you have questions about how to do that, man, there's some great videos at our website that you can go look at to see how to put a mask on and take it off. Can students safely ride the bus? You know, you and I are not school experts.
No.
We're not busing experts.
No.
But again, we're infection control folks, right?
Yes.
You especially, you're the ID doctor. And I just kind of prattle on a little bit. But the reality is that, again, I'm going to sound like a broken record. The rules of infection control, they travel with you wherever you go, including the school bus. So if you expect to get every seat taken and have 3 to a row and have the kids really crowded into the bus, yeah, it's not so good. If there are ways for to have more distancing on the bus, then absolutely I think people can be safe on a bus.
Yeah, and it's difficult. We understand just the same with classrooms, school buses are going to be crowded. But if you can have the separation of the seats, if that is viable in your school district or with your school bus, but if you can have the children wear the mask as well, that will all cut down on the risk and decrease the risk as much as possible. So it's going to be difficult. Obviously, the bus is a very contained environment. You are on there for longer than 10 minutes. Again, in these cases, you may want to consider having your child go with eye protection or eye goggles as well.
And you and I have modeled our eye goggles pretty consistently.
Yes, mine are
I always,
there.
they're out there, but you know, here, oh, I've got my toothbrush in there too. Don't look at that. But it's really good to put those goggles on just to say, see the cool features on the side, around the top, on the side. And then, you know, you look pretty darn good with these on. At least I do.
Yeah.
I think it's probably an improvement.
And my son rides the public school bus, so I may get him some eye protection as well.
You know what? And you can find some cool looking eye protection out there right now, and they're like $10 on Amazon.
Be
So
styling.
it's it. And then you can find these in all sorts of places, and you can be styling.
That's
and for some of us, it covers up how big our forehead is, which can be a win. All right. So if a teacher or a student tests positive, what should the school and parents do?
So I think there has to be a real look at what we do now when a student or a teacher does test positive. So we know there's already probably a crunch on teachers in general. We have heard that there is a crunch on substitute teachers also. You know, the rules of if a student around you, if a student has it, then who is really a contact of that student? Is half the class going to be out for 14 days? Is the teacher going to be out for 14 days? And and then what if they do develop symptoms? I think there's going to have to be a look at what we do when a student or a teacher is positive. Is it going to be really taking a deep dive into who is around that student themselves, so you don't have the whole class out for 2 weeks and maybe up to 3 or 4 weeks? We don't have a good answer for that, but we know that is a very important issue. And I don't know what we are going to do, because then if you have teachers out for 2 weeks or more, that can seriously impact everything around the school as well. So I think there's going to be, as we move forward, hopefully there'll be guidance from the CDC, from the state, and from the Board of Education about what to do if there is a student positive in your classroom. But what are the main important things that we can do, especially with the older classes? We've talked about this. And we have evidence based on the local cases in Springfield, Missouri, where there were 2 stylists. They wore masks, their clients wore masks, and there was no apparent spread of the disease. So if we can get those students, especially the older students, to continue to wear masks and be as far apart as possible, I think you're going to have less actual exposure of other children and other teachers, counselors, other administrators as well, doing that moving forward.
Yeah, it really is all about that. And we can be so much safer if we just wear a mask. And if somebody's positive, there's going to be contact tracing by the county health department. So
Yeah.
they're going to be, that it no longer is so much a school issue at that point. It becomes a county health department issue.
Yeah.
And they're going to be treated like they're a positive patient. There's going to be contact tracing, as you're saying, and we're going to have to do that.
But I do think that scenario needs to be looked at as we move forward, because you can't just have teachers out for 14, 21, 28 days and then half the class out for that much as well.
Yeah.
So I think that needs to be looked at, and maybe have some more guidance about that.
A lot of big questions about that. You know, we had the head of the Kansas Commission on Education, and out online they have that 1,100-page document that
Yeah.
gets into a lot of these questions, and I think that would probably be helpful. People have further questions around that. Other countries have contained the virus before starting back to school, are we being premature here in the United States? And I think part of this comes down to a little different philosophy in the United States, because we have a lot more states' rights and local control, et cetera. And what we know, especially true in Kansas, is we've actually said, well, let's look at it from a county-by-county perspective, because every county is a little different. And so the same rules that apply to Johnson and Wyandotte apply out west in or central western Kansas, where there may be, in fact, some counties which have not had a case of coronavirus yet that's been tested positive. They may have had it, they just don't know. But still, nevertheless, the number of tests that are positive in a sparsely populated county may be a lot less. And so it's hard to say you shouldn't be opening schools in those counties. Again, you want to still practice good infection control. And I think that's kind of the way we have to take a look at this question, is you have to break it down and saying, what's it like in your area? The second thing you have to think is it safe? Do you have a good plan to address physical distancing and mask wearing and trying to make sure that students and staff and teachers all stay safe? If those things are in place, I think you can reopen safely. We've opened some other places safely. But a lot of it comes down, I know you guys got to be so tired of us saying it like this, but it comes down to the basic rules of infection control. If you follow them, you're going to do a lot better off than if you don't. And I think that's really the key, perhaps repeated a lot, but the key message.
Yeah, as you had said, in the infection dynamics in that community itself. We understand that a lot of the talk about getting schools back to in-class sessions occurred 3-4 weeks ago. We know a lot of things have changed in that time. There's been nearly exponential growth of cases. Now the hospitalizations are going up, and even deaths overall are starting to go up, and they're lagging behind hospitalizations, which we have seen that. So, but as we get more and more states, more and more counties and communities having mask mandates, doing those things, by 3 or 4 weeks, maybe we can flatten the curve so we do have less of spread than we do right now as well.
Yeah, I think that will be a big win,
Yeah.
and we're taking all sorts of actions, and we've been working closely with the university to make sure the university reopens in a safe manner, and I think they're doing a great job at KU, a great job. Should schools take a student's temperature each morning?
Yeah.
No, that's kind of controversial. Does temperature screening really work?
Yeah. You know, I have a lot of questions about this as well. I was asked this yesterday in conversations with a school here in the city. I think that's difficult, number one, because we know so many people are asymptomatic.
Yeah.
Now, if you break
Especially
that
in a
to young
younger
children,
group.
that's even more. So that's even more difficult about the testing. Now, is it reasonable to do temperature screens on the teachers? Possibly. We know that for KU, they are looking at doing an app where you have to answer a couple questions every day. And if you screen well on those and you get a red mark or a green mark and you're able to go into class and scan it. We know some of the other universities are doing that. Is that reasonable for a primary school or anything like that? Probably not. But is temperature screening reasonable? You know, I don't know. It continues to be controversial. Certainly if there are other symptoms, that's easy to do, but just screening for temperatures, I don't have a good answer for that. Just because we know that children in general can overall be asymptomatic.
Yeah, those are important things. With the current COVID-19 numbers, do we think it's safe to play fall sports? Now, that's another hard question, but I think it's going to come down to the same stories we've had, is what's the prevalence like in that county and that area? What's it like when they practice? How can they make sure the kids are safe? I mean, I do think this is a challenge, especially in sports like football, where there's a lot of physical contact and it's hard to achieve physical distancing in a football game, unless you're a wide receiver and that's what you're trying to do.
Yeah, or in a locker room. We know you're going to be in a confined space for that amount of time. We know that middle-aged and high school-age kids right now in their social groups are spreading the disease. Just, if not as much, about the same as the 20s and 30s who are going out to the bars and going out to the other gatherings. So, is it safe to play fall sports? I think we're going in that direction, and I think that there are a lot of things that people have been doing, whether it's the leagues or the coaches individually. We know that summer sports are going on right now. A lot of baseball tournaments. A lot of other people are getting back into doing training, such as cross-country, soccer, early football as well. Right now, is it playing safe? Maybe, but are people gathering to watch it, and the families and all that in the stadium, that might be a little bit more dangerous as well. The only good thing about that is that everybody is outside, so I think that helps.
It does help. You know, the one thing, Dave Smith was here earlier this week, and he's our director of youth sports here at KU, medical director, and does a great job working with us, and works a lot with some of the sports teams in the city, the high schools in the city, as well as some of the different organizations. And so he made the point that if kids can get into the activity safe, then generally they're pretty safe in the activity. I think a lot of it is they're outside. You start talking about indoor activities, that may be a bit more of a challenge, like basketball and volleyball, but hopefully by the time that season comes along, we're going to have vaccines available. Hey, listen, as we wrap up the program today, we got some cool stuff. We're not done yet, so hang tight for just a minute. First of all, some cool looking masks. Gretchen and her daughter Taylor wore masks and their eye protection. I love that.
Yeah.
We talk about eye protection all the time. It's the third mucous membrane, right? 1, 2, 3, trying to cover up all three. Well done. They write, "We know we look nerdy." I'm right there with you. They know we look nerdy, but we are as safe as we can be. And I want to just say, you look cool. I would not apologize for being a nerd. It's the best thing, especially if you love Star Trek. Live long and prosper. And from Jean Dumovich, her nephew Bodie loves his new Spider-Man mask. He's a true hero wearing a mask, and here's how we know that. We know that masks work, and we got a cool thing to show you. So we're ready to roll on what I'm going to tell you is the best Sub-Zero freezer in Kansas City. And I'm going to say, Dana, well, I think we look good.
Yeah.
Okay, maybe we don't look good. Come on, brother, you got to hang
You
with
look
me on
good.
this.
I'm good.
No, I don't know that I look good. I'm darn near 60.
I was cold, so
It was a little chilly in there.
it works. The freezer works.
It made a point, though, didn't it?
It did.
It is safe to wear a mask, and it's important to wear a mask. So here we go. We're broadcasting live from a 0-degree freezer, where I wish I could tell you we're here for a cold beer, but instead what we're really doing is telling you what a breath cloud is like. And I'm here with my good friend, Hawkeye, and we're here to make a point, because if we start talking like this across from each other, wow, it goes out about 3 or 4 feet. How are you?
Doing good.
Where are our breath clouds going? It circulates up in my head. It goes high, it goes low, it goes everywhere. This is what happens when you're out in public and you're talking to each other and you're closer than 6 feet away. Let's try and do a little Royals here. How about if we do Let's Go Royals? Yeah. Let's go Royals! Ho, 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 ho! Go Chiefs! Oh, say, can you see? There are breath clouds go traveling to each other. But what happens if we put on a mask? Let's just see where our breath clouds go. Hey, Hawk, how's it going?
I'm doing good. It's cold in here.
You know, it is cold in here, but I'm feeling better because your air is not coming to my space right now.
And I can't sense any or see any of your breath.
It's a lot better. Shall we do that Royals cheer again?
Let's do it.
1, 2, 3. Let's go Royals! Go Chiefs! Oh, say, can you see? Right there. It doesn't go anywhere. You know what that means? It means we're keeping each other safe. You can do it too. Do it with your family. Do it for... Wear your mask. It really does make a difference.
Yes.
You know, give that man a contract. I think he should have an album contract for his
You
vocal
sounded
talent.
good. You did.
Yeah, well, maybe not.
I was surprised.
Yeah, well, let's not talk about sounding too good when it comes to singing. Otherwise, I may not have a job. As my family says, you got to keep your day job.
Yeah.
So, but it does make a point. We have a breath cloud, and when you go out in cold air, you can see it, and it's all around you, and you can see how far it goes,
Yeah.
especially if you want to try and blow it out across toward each other. But when you put a mask on, it came to an abrupt halt. Masks work, and they'll keep you safe. On Monday, we're going to talk more about how to keep you safe with Lance Williamson, who's Infection Prevention and Control Manager here at KU, John Rule, an epidemiologist with KDHE, one of Lee Norman's right-hand folks, and Mario Castro, the Vice Chair for Clinical and Translational Research in the Department of Medicine, and the head of our big clinical research organization here at KU. He's a pulmonologist. He's going to be talking about a vaccine trial that's starting here in the very near future, and the state of the vaccinations, the vaccine trials around the country and around the world. So that's going to be a great program. We look forward to seeing everybody on Monday.
Yes.
You have a great weekend. Stay out of sub-zero freezers. By the way, the temperature really was 0 degrees in that freezer.
cold.
Hands off to our staff, because they were in there with us, and they were freezing their tails off.
Yeah.
It is remarkable that when you go from 90 to 0, it's a pretty big temperature change. But take home the lesson, as you have every day. Just remember to wear a mask. It's what keeps you safe. What keeps your community safe, keeps your loved ones safe, keeps us all safe. Until then, there's no place like home. We'll see you Monday.